All right, so therapies. This is a good kind of companion part to all the psychological disorders. So as you look at each of the different mental illnesses that are out there, understanding what they are and everything, what are the treatments that we have available to help individuals who are experiencing one of those things. All right, so on the therapy side of things, what we're going to see is that there are a number of different theories out there. And each of these theories wants to explain why they think a mental illness is occurring in the first place. Okay. And then, for whatever the reason may be, if that's why they think a mental illness is happening, this then are the interventions that can be used to treat that mental illness, right? And so those two are connected to each other. Here's a theory, and based on that theory of why we think it's happening, this is also what we think will help the person. This is the type of treatment that we would suggest. Okay, so key thing here, there are a number of different theories, right? So when I was in school to be a counselor, that was the vast majority of our coursework, learning these different theories. And the key was trying to figure out which one matched up kind of with your worldview and how you viewed mental illness, right? And that's the one that you kind of wanted to focus on. Learn as much as you could about it, get familiar with the techniques and the interventions, and that's what you would then use with your clients, okay? But because they are theories and they have different explanations, what that also means is that you do just kind of pick the one that you like the best, okay? So some are going to be maybe better than others. Some might have more research to support it than others. But the key thing that we're going to see with therapy, and when we try to determine how effective it actually is, the number one most important thing is not what theory is done, what interventions are done. No, the number one most important factor for determining the effectiveness of therapy is how well do the client and therapist get along. Okay, that relationship. Is there a rapport there? Is there a genuine care and trust that exists? Okay, if that is present, therapy will be effective. It doesn't matter all those other things. Okay, what it also means is that you could be arguably, objectively, the best therapist in the entire world. But if that client doesn't like you or the connection isn't there, it's not going to work. Okay, so in addition to being aware of the different theories that are out there and the different approaches to therapy, what I often will tell people as well is that therapy itself is a lot like dating. Sometimes as the client, sometimes you have to try out different therapists until you find the one where you have that connection, where things start to click. Far too often, I've met individuals who have tried therapy and said it's not for them and it doesn't work. And it could be is that the therapist they went to just wasn't a very good one. And I do understand the frustration and the lack of maybe desire, motivation to try and find other ones, because it does take a lot of effort. Okay? So going back to the theories, though, generally speaking, we can kind of break them into the two broad categories. One of them are the psychotherapy approaches. So this is where you go see a counselor or a therapist, and it's the talk therapy part. Okay? And it has its own theories. And then there's the biomedical approach, which is often associated with a biological theory. Right? So the idea here is that if there's something wrong, it's something physically wrong, maybe just with neurotransmitters and how they're functioning, or something with neural pathways. There's something going on, and here is a medical way that we can fix it, either with medicine or some type of other treatment. Right? So biology, something physical, is what's causing the problem, and then we're going to introduce an intervention that's going to try to address that also from a physical or biological way. Okay? So that's the biomedical approach. With the psychotherapy, there are dozens of theories. We're just going to look at a few of them. One of them comes from Freud. Freud's main idea was all of us have what he called the unconscious. It's a part of ourselves that we don't have access to. We're not aware of it. A lot of things, though, are still occurring in this unconscious. We have a lot of thoughts and desires and urges and emotional processing. And so Freud's overarching idea here is that if you have some type of conflict in that unconscious, that leads to the different mental disorders, right? So if someone's experiencing depression or PTSD or schizophrenia, whatever it is, it's due to conflict in that unconscious, right? And so his interventions and his techniques are trying to resolve that conflict, right? And the difficulty is that if it's residing in this unconscious, and by its definition, we don't have access to it, what are you supposed to do? And so the goal of all his interventions is insight. And by that, he specifically was referring to gaining information about what's actually happening in the unconscious. And then with that, you can kind of work through everything. Okay. There's also the humanistic perspective, right? And so here, a lot of it's focused on what we call person-centered therapy. We want to help the person be the best version of themselves that they can be. It's very empowering. We want to make sure they feel like they are the ones in control of their lives. They are the expert of their lives. And they might already know the answer of how to work through things, and we're just there to kind of assist them on their journey, right? But essentially the main focus is helping each individual be the best version of themselves they can possibly be. And this is where we have some overlap with Abraham Maslow, who gets put into this area in his theory of self-actualization, right? That pyramid of trying to reach the top there where you reach your full potential and have a sense of greater fulfillment. Okay. There's behavior therapy. This is going to go back to the techniques related to operant conditioning and classical conditioning. And it's going to say if you're experiencing mental illness, it's because you've learned to behave that way. Okay. And so the goal of the therapy is to help you unlearn those behaviors, right? So anything that can be learned from a behavior point can also be unlearned from a behavior standpoint. And so it's just kind of going through and methodically applying all the principles of operant conditioning and sometimes classical conditioning to change someone's behavior so that it's more in line and healthier. Okay. Oftentimes associated with this is the realm of cognitive therapy. And so here the idea is if you're experiencing some type of mental illness, it can almost always be traced back to your thoughts and the way you're thinking about something, right? And so there is a large amount of the research that actually supports this specific theory, and often gets combined with behavior therapy. So it's called CBT, cognitive behavior therapy, and it's almost, I don't want to say the gold standard, but this is the most evidence-backed research or theory that we have. And so what we want to do if someone is experiencing, in particular, depression or anxiety, we want to look at what are the different thoughts that are leading to that. And how do those thoughts form? Where are they coming from? And if we can identify them at their source and adjust them and change them, then we can, it's almost like a ripple effect. Everything else just kind of auto-corrects itself, right? So if we have the proper way of thinking, our behaviors, our emotions, everything else will be aligned correctly and be able to process correctly, and then we're not experiencing any more difficulty. Okay. I think the only other thing to note is that outside of the different theories, the different techniques, the different approaches, it can go beyond just individual therapy, right? So sometimes you'll have couples therapy or family therapy where multiple people are involved that are connected or already from in some kind of way. But then there's also group therapy. Again, multiple people involved. Here, there's usually not a previous connection, but you're coming together all experiencing the same thing, right? So you'll see this a lot with substance abuse counseling, grief counseling, things like that. Everybody's experiencing the same thing, and they're going to process it through together. Okay. Now, what I would say is that I think group therapy is actually very underrated. Most of the research is going to indicate that it is just as effective as individual therapy at a substantial lower cost. And I also think, as a previous person conducting quite a bit of group therapy, I think it has a distinct advantage over individual therapy in that, in my experience, a lot of people suffering from a mental illness unfortunately develop this mindset of no one understands, no one gets it, right? I'm going to see somebody and they're very empathetic, but they don't truly get it. And yet you go to one group therapy session and people start checking in and talking about how their week was. And it's almost like, oh my goodness, they get it. These are my people. And just that sense of feeling seen and understood does wonders to help somebody. And that's before you even get into the techniques and the interventions and seeing how other people, what struggles they're having or what successes they're having. Now you can use that to better yourself as well. So don't sleep on group therapy. It's a great way to access care at a lower price point, and it can be very, very, very beneficial.